All right. So next we have Dr. Fernando Su, who will be presenting his work, Online Self-Management for Chronic Burn Pain, Results of a Randomized Controlled Trial.
Hi, everybody. My name is Fernando Su. I'm a pain psychology fellow at Johns Hopkins, and the work I'm going to be presenting today is related to a online self-management program that we conduct in conjunction with a number of different sites across the U.S. to help folks with severe chronic burn pain better manage their symptoms. Here are a number of authors that are associated with this project. No big disclosures other than we partnered with the Phoenix Society for Burn Survivors, the largest nonprofit for working with individuals who have suffered burns, serious burns. All right, so 40,000 individuals are hospitalized every year in the U.S. Related to severe burn pain. And a number of them go on to develop significant, not only chronic pain, but chronic disabling pain in the future. And often associated with that chronic burn pain is a number of co-occurring or comorbid psychosocial symptoms, not only depression, but anxiety, self-image concerns, and PTSD related to this very traumatic incident that's often associated with these larger, really significant burn injuries. Now, here's the challenge though. We know that psychological services for chronic pain are often considered a frontline intervention. And these individuals who are experiencing this burn pain often do get a number of different services when they get into the burn unit, right? And they're receiving that inpatient rehabilitation psychology services, whether it's related to pain, whether it's related to adjustment, just coping with the really significant severe interventions that are going on in the moment, whether it's grafts or plastic surgery. But here's a survey that was conducted a number of years ago looking at actual access to psychological services for folks who are experiencing burn. The majority of psychological services for burn are presented when they're hospitalized in inpatient, right? But as time progresses, these folks are getting less access to these services. But the challenge is that there are only a few number of large burn hospitals in the country, and they are receiving great services over there. But when they go back to their homes and access to care is a little bit more challenging, oftentimes these individuals are suffering from a really large burden and aren't getting the services that they so rightly deserve. So as a way of addressing this, right, my team over here developed a online autonomous self-management program called Take Charge of Burn Pain to address access issues so these individuals can get care while they're dealing with their chronic burn pain and co-occurring significant mental health concerns. And so for this program, what we did was we developed this program based off a CBT manual. A number of individuals talked about CBT, but we adapted it specifically to a chronic pain population using a number of different provider stakeholders to make sure that it's adapted for this population. And so for our population, we specifically recruited individuals who had significant burn pain for at least 6 months or longer since discharge from the hospital. And we had individuals randomized to the Take Charge of Burn Pain or a time equivalent education control condition. And the main measures that I'm going to be presenting today are the ones that are most concerning for these individuals. So pain intensity, pain catastrophizing, and PTSD symptoms related to this event, to the burn injury event. And then we ran a number of linear models adjusting for a number of co-occurring factors. So I just wanted to address the flow chart over here, right? So like I said, we had 96 individuals who were recruited, 94 who were actually assessed at baseline, and then randomized to either of the conditions. So just briefly, what I want to address right here is, like I said, we had 7 lessons. Bookended was the introduction to pain psychology and then a summary. But in terms of the number of people completed the full program, as you can see over here for the Take Charge of Burn program, we had about a 50% completion. So about 25 of the 47 completed the individual intervention program. So something I'm going to be talking about later on. But when we just look at the data at post-treatment, so right after completion of the program, adjusting for some of these variables that I talked about before, we do see that it is an efficacious intervention, right? This completely autonomous online self-management intervention can be effective. So we had a pretty decent and significant effect size for pain intensity, by the way. Lower numbers are better for this. So in the light blue group, that's the Take Charge program over here, we found that at post-treatment, significantly better pain intensity, as well as lower pain catastrophizing, and though not significant, a decent effect size for PTSD symptoms between the 2 groups. So what can we take away from this? What can we take away from this? Like I said before, folks are getting, at least if you're close to a large burn hospital like the great programs they have at UW, or I'm finding out today at Yale, you get really great services when you're hospitalized in service. But it's harder to get access to those services afterwards, 6 months later, when you're dealing with a number of symptoms that are still ongoing while you're rehabilitating. So using an online self-management program can be one way of improving access to these individuals to help them better manage their pain and co-occurring mental health symptoms, right? But like I noted before, completion and engagement with this intervention can be a bit challenging. So in the future, one of the things we're trying to do is not only look at who is best served by this kind of intervention, but what are strategies that can be used to pair up with an intervention like this with a low cost, easily accessible intervention to improve engagement and ultimately reduce chronic pain burden for this population. And with that, I want to thank you all for your attention.
Thank you. Okay, we will try again.
I guess we try again.